the subjective assessments, we're going to ask the patient what is her problem to make her to come for us. For example, madam, what is your problem that makes you to come for us today? Okay, so this is Madam A, which is 38 years old and has a knee problem or knee pain. Okay, so then after that we're going to ask the pain score from this patient. Okay, pain score is normally we use the VAS score, which is from 0 till 10. And then the patient, and explain to the patient about the pain score, and the patient needs to pick any number which is represent the pain. Okay, 0 represent with no pain, 5 represent with the moderate pain, and then 10 represent with the possible worst pain. Okay, so after that, we're going to ask the patient about the nature of the pain. Okay, and then the aggravate factor that may increase the pain, as well as what is the easing factor that she do to reduce the pain. And we also need to ask the irritability for the pain as well. Okay, so we just need to move for the current history. Current history is what is the actual causes that may cause the knee pain. For example, any history of fall before, any injuries that is related with the right knee before, and then this is current history. And then for the past history, there is any history taking which is associated, which is related to the injuries that happens today. Okay, for example, any operation, any fracture before over the same side of the limbs. Okay, so and then for the current history also, we just need to ask the date onset, when it actually happened. The concept is 4W1H, when, where, what, and how this can be happened. Okay, so rather than that, we're just going to ask about the special question with according to the general health, and then any investigation did by the medical team, for example, X-ray, CT scan, or MRI. And then we just also need to ask patient what is her occupation, and then what is her hobby, which is may be related to the injury or pain that occurred today to her over the right knee. And then rather than that, we also need to ask patient any medication that she consumed, okay, which is also may be related with her current condition right now. So this is for subjective assessment that we normally do for patient. So next, we're going to move to the objective assessment. Okay, we are going to move to the objective assessment. It's normally with this kind of patient, we normally do the observation, which is general and local observation. Okay, the general observation we are normally do for the gait. Okay, so ask patient to stand up, and then ask her to walk in front and backward. Okay, for example, ask the patient to walk. Okay, turn around, and then we just need to observe the gait. Okay, for the second one, we just need to observe for the local. For example, is a posture, especially over the knee region, which is any deformity that can be seen here. Okay, for example, genital curvatum, and then any visible swellings over the knee. Okay, so for the next thing, we're just gonna see for the local observation. What is a local observation? Is we are totally concentrate over the knee area. Okay, so ask patient to lying down. Okay, you just lying down. Okay, we just ask patient to lying down, and then okay. So for this one, this is the right knee. We just need to expose for the right knee. Okay, we just can see any deformity, any swelling, so we do a palpation, which is palpation to see any warmthness here, any swelling, any that we just can also observe any redness here. Okay, so this is for patellar mobility. Okay, we do the patellar mobility over the lateral medial and superior and inferior. Okay, all the direction. Okay, so don't forget to compare with the other side as well. Okay, so then after the patellar mobility, we're going to check for the muscle flexibility, or we'll call it as a special test. Okay, so special test, one of the special special test that we did, okay, is a patella grind test. Patella grind test is put your hand here at the base of the patella and push it inferiorly and ask patient to squeeze her tight muscles. Can you just squeeze your tight muscle, miss? Okay. If this indicate positive if the patient experience of pain while doing this test. Okay. So next, for the next test, we are going to test for the SLR 1990. SLR 1990, we are going to passively move the limbs 90 degree of hip flexion and 90 degree of the elbow, of the knee flexion, and then ask patient to actively straighten her knee. Okay, can you just straighten? Okay, if patient unable to straighten his knee like this, okay, this indicate hamstring tightness. Okay, so then we also move to the next things that we measure for the, we just need to measure for the ROM over the knee. Okay, ROM we'll normally do to, we normally do the ROM while to measure the flexion, which is in a prone lying position. Okay, next can you just turn sideways. Okay. For this one, we just need to place this. We just need to place the fulcrum here over the lateral condyle of femur, and then for the moving arm, which is located over the lateral malleolus, and then stationary arm over the greatest trochanter, and just ask patient to bend your knee. Okay, like this. And we just need to apply for overpressure for the passive readings. Okay, so in this position, we also can use straightly to do knee extension. Okay, you can ask patient to straighten like this with the same point dimension for knee flexion. Okay, so then this is for ROM. So we can also do for MMT for the hamstring as well. Okay, so MMT for the hamstring, we just need to put resistance here and ask patient to bend her knee. Okay, bend some more, some more, some more, some more. This is for grade 4, and then for grade 5, you just need to add on some more resistance. Okay, next we're going to move. Okay, we're going to measure the ROM. We're going to measure the MMT for quadricep. Okay, madam, can you just please sit edge of the back? Okay, but don't forget to compare with the normal side as well. Okay, so then we're going to for the right knee here. So we just ask patient to straighten. Okay, straight your knee like this. Okay, and try to resist my hands. Okay, try to straight your knee, resist, some more, some more. This is MMT for the quadricep muscles. Okay, so we just need to add on some more resistance